Okay, we're talking about maximum out-of-pocket limits for Medicare Advantage plans. And if your Medicare Advantage plan has drug coverage, you'll actually have two different maximum out-of-pockets. So first, let's talk about medical. On the medical side, what's included in the max out-of-pocket? So if your plan has a deductible, co-pays, or co-insurance that you would pay throughout the year, then that all counts towards that maximum out-of-pocket limit for those 12 months, January through December. Now, there is a federal mandate on the limits. It does vary depending on the plan, so they can be less than this. I would say national average is probably somewhere around $5,000 or $6,000 maximum out-of-pocket limit for the medical side. But there is a limit for HMOs of $9,250 and for PPOs 13,900. Now, what is not included in the medical max out-of-pocket? So if your plan has premiums and you're paying a premium, that actually won't count towards the max out-of-pocket. And then things like non-Medicare extras, the dental, vision, hearing, things like that. If you have an HMO and you have something done that's outside of network, that would not be included in that either. On the prescription drug side of the house, this is a fixed max out of pocket on every plan. So for 2026, for your prescriptions, the maximum out of pocket is $2,100. And we actually know what the MOOP is for next year for 2027 is $2,400. So it has gone up, unfortunately, for next year. Now, what's included in the drug MOOP? So your deductible, if your plan has a deductible, would count towards that. And then co-pays or co-insurance, percentage of cost, things like that would count towards this limit for the year. And again, that's in between January through December. So you know you've got a cap on your drug costs for the year. Now again, on this would be for any drug that is on the drug formulary or the drug list for your plan. If you get something outside of that, it would not count towards this. And also something of note, that new GLP-1 bridge program for weight loss that Medicare has, remember that $50 copay, if you qualify for that program, that $50 per month does not count towards the prescription drug max out of pocket. So keep that in mind as well.